Hi Lisa, how are you? Hope you're having a good afternoon. So I have an order to administer an insulin injection of regular insulin to a patient whose blood glucose levels has become elevated. The doctor has given us an order to treat the patient. The patient's status right now, he or she has a blood glucose levels of 275 milligrams per deciliter, and the doctor has ordered the regular insulin. And so what's really important with this medication is that it is used to treat a state of hyperglycemia. And what the medication does, it's an anti-diabetic. It actually helps decrease those blood glucose levels to a range that is more appropriate for the patient. Now, one of the side effects to look out for this medication is that sometimes the patients do become hypoglycemic, and so sometimes we have to monitor that their insulin hasn't dropped too much, because then they could kind of get a little anxious or cold and clammy. And the other thing that's really important with medication administration is that we need to do the 5 rights of medication. In other words, we have to triple check everything, but it's very important that we have the right patient, that we have the right medication, that we have the right dosage. And from the sliding scale, I'm going to be administering 8 units. And the dosage, that we have the right route, it is sub-Q, and then that it is the right time or frequency. And for this order, I'm just going to assume that the frequency or the time is based on the doctor's orders. Okay? And then at the very end of when I finish administering the medication, it's really important to chart and document everything. The name of the drug that was administered, it's the regular insulin. Also, how much? That was 8 units. The route, it was sub-Q. Where the injection was given, it's going to be given in the abdomen. And then we want to make sure that we also, with the date, we also want to make sure that we include the time. So let's go see the patient.